This is the Amy Edwards Show, and we're here to up-level our lives in every way at every age. Let's do this.
If you're using a pharmaceutical or something really strong that Western medicine is great at, then you force the body to have a certain response. And when you force the body to have a certain response, you're gonna get collateral stuff on the back end. Maybe a little collateral damage. Maybe it's just that the body is, shifting focus in a different direction, but you can't force the body to do stuff without a reaction somewhere else. And so I think ozone is probably one of the strongest natural things that we have because it nudges the body in the right direction. It's more of a nudge. So we get less of that icky response on the back end. So we're really not seeing a ton of, negative side effects.
Yeah.
We're just supporting the body to do what it needs to do on its own.
Hello, and welcome to the show. It's part 2 today of Biological Dentistry with Dr. Toni Engram, and I could not be more excited because we left some things unfinished, and she was kind enough to join for part 2. So if you haven't listened to part 1, I highly recommend it. So go check that out. But you can always listen to this one first and then go back. You know what? There's no right or wrong. You're here for a reason. So thank you for being here. And so let's welcome Dr. Toni. Dr. Toni, thank you for joining again. A little quick refresher for everyone, or if you're new, here's a little bit about our esteemed guest today. Dr. Toni Engram is a Dallas-based, SMART certified biological dentist. She's also an integrative health coach and the founder of Flourish Dental Boutique, great name, a truly holistic dental practice redefining the way we think about oral health. She's healed her own autoimmune issues and stepped away from conventional dentistry to really consider our whole health. And it is utterly fascinating. She's on a mission to bring whole body wellness into the dental chair, and I could not love it more. She's all about guiding families, children, everybody into a more toxin-free, informed way of living with their oral health, which is actually your whole body health, right?
Preaching.
Preach.
I love it.
I'm so into it. I'm so into it because we just separate it as if it's something else. I didn't even ask you before too. What do you think about dental care being an add-on to our health insurance? Don't you think that should be included in our health insurance?
Man, that's a loaded question.
So sorry.
It's great because it's such a good discussion. So in terms of importance, is it just as important as seeing a kidney specialist or a liver specialist or an OB-GYN or any of the other million specialties that we see in medicine? Yes, we're just another specialty in medicine. So absolutely, it should be included. But as a profession, do I want dentistry to be more entrenched into medical insurance? No.
Excellent point. What a good point.
Bad enough just dealing with dental insurance. I don't want the nightmare for my colleagues of dealing with medical insurance too.
Yeah. That makes total sense. And, I do things outside insurance too. A lot of my blood testing and all that kind of stuff. And I mean, they would probably take issue with covering salivary testing anyway, and you'd have to fight that fight, which they're so behind in what they would cover, right?
We fight everything. And I'm probably in the 10%, maybe even less than 10% of how much or more accurately, how little I deal with insurance because I'm completely out of network, but we still will file claims for patients. And even just that, we want you to be able to use your benefit. You're paying for these benefits or your employer's paying for these benefits. We want you to be able to use them. But at every turn, there's additional fighting and they find new games to delay payment. And they think if they just delay it long enough that we'll quit asking. So it's a nightmare.
How annoying. So annoying. So, it makes me so mad.
It makes it so much more expensive for the patient.
Ugh.
Because then, like, if you're at an office where they're 100% dealing with insurance, then they have to pay somebody to literally just sit and chase insurance claims all day long. They have dedicated team members just to do that and to fight with them and do that back and forth. It's silly.
That's crazy. Our whole system is so messed up. So,
I know.
all right. Well, let's dive into some of the things that we missed. And I learned that October is Dental Hygiene Month. So that's nice because these are coming out in October. So we are celebrating Dental Hygiene Month. I was listening to, reading an article. It was a little, maybe year old or something about Brian Johnson's routine. Are you familiar with Brian Johnson?
Mm-hmm.
Yeah. So it said after eating, he brushes, he water picks and flosses before rinsing with a tea tree oil and applying an antioxidant gel. And doctors say he has the gum inflammation of a 17-year-old. And I was curious, do I need to be rinsing with tea tree oil and using an antioxidant gel?
It depends on which 17-year-old they're comparing to.
There's a lot of 17-year-olds to choose from. Some eat sugar all the time.
Have you met some 17-year-olds?
Right.
That's not what we should be aiming for.
Man, not.
No, but I would say in general, and I don't remember which antioxidant gel he was using, but
I
in
don't know.
general, it's not bad advice. And the tea tree oil, I don't mind that really. It's a nice natural antimicrobial. So I would say we just want to be careful that we're not overdoing it with the antimicrobial rinses. We don't want to be killing too much of the bad bacteria, or too much of the good bacteria along with the bad. But in general, as an antimicrobial, I really like tea tree oil. So I would say, as long as we're not overdoing it, then yes, I approve. What I do remember is I think he was using a toothpaste that maybe had fluoride in it still. And I think the last time I looked at his routine, that was the only thing that I would take issue with.
Yeah. Okay, cool. Yeah, when they say rinse with an oil like tea tree oil, do you like dilute that with something or is it just like
Yeah.
you do? What do you
Oh, yeah.
you mix it with what?
There are actually commercially available mouthwashes that have tea tree as an ingredient.
Wow.
And they use, I don't know what all they like, glycerin, things that will help it emulsify and be like evenly dispersed throughout the rinse. And it still feels like an actual rinse instead of feeling like an icky oil.
Yeah.
If you're doing it, like if you want to be just as pure as possible, then yeah, you can absolutely make your own. If you're making it like right there the day of, then I have a lot of patients that will just take a little mason jar, they'll put some water in it, and then put a couple of drops of tea tree oil, and then all kinds of other things that you could add to it. You could do a little bit of baking soda, a little bit of granulated xylitol, but then they'll shake it up really, really good to get the oil to disperse.
Sure, that makes sense.
In the water, and they'll use that. Or if you want to have it be an oil where it'll all be easily mixed together, then you can do tea tree in any kind of carrier oil, and you can use that and do some oil pulling or just use it as an oil-based rinse.
I see too. Cool. And I just pulled up his current routine, by the way.
Oh.
And he previously used the tea tree oil 2 to 3 drops with water and mixed it like that, but he discontinued it, but he thought it did improve at the beginning. And he says now he is currently using 2 types of toothpaste, neither of which have fluoride. So, and a tongue scraper. He's got tongue scraper on here. So, yeah. So I know I still haven't started, but believes me, it's Dental Hygiene Month. So what better time to start scraping?
Now's a good time.
Yes, absolutely. All right. So some of the things that we didn't cover that I know you talk a lot about, one of the most important things I think that you talk about is root canals and your immune system. And so I wanted to start there because it's so deep. No, I'm just kidding. I was trying to make a root canal joke.
Literally.
And And you know what? I've never had a root canal. I don't really know what they are. So maybe you could explain a little bit about it and then what the alternatives are, because I know so many people that have.
Yeah, yeah. And it's so nuanced too. Like I love the discussion. The bummer is that sometimes some of us will, especially either in the holistic community or biological dentists, the talking points, like the scary talking points, get a lot of attention, but it's super, super nuanced. So yes, I think root canals have issues, but I think there's balance that we can have. And it's, again, all about informed consent and making sure each patient knows all of their options. So I hate to completely demonize the procedure itself. But what
It sounds scary as hell. I've always heard a root canal. I don't know. It's just
yeah,
for me, I
and
don't have any idea what it is. Like literally, I don't know anything. And it just gonna sound scary. I'm just like, oh my God.
it shouldn't be. It shouldn't be scary. The procedure itself should be no more difficult than a filling or a crown or any other dental work that you can have done just with local anesthetic. So it should be easy. There are exceptions, of course, but what happens is the nerve of the tooth becomes either so inflamed that it cannot recover, or it doesn't recover and dies and becomes necrotic. And so what could be done to save the structure of the tooth is the dentist or the endodontic specialist will go in and actually remove the nerve from the inside of the tooth, which means they're taking teeny tiny itty bitty little files and going into the root canal of each tooth. And depending on the tooth, sometimes there's one canal, like a tooth in the front that just has a single root. And then if it's a large molar, sometimes there's 4 or even 5 root canals where nerves lie. So the dentist will remove that, and doing so will allow you to maintain, and they pack it, they fill it, they disinfect it, seal it up, and then the tooth typically feels better because the nerve is gone. The necessary thing that happens is that when you remove the nerve of the tooth, you also remove the blood supply to the tooth. So that's where things get a little sketchy, because there's still bacteria all in and around the roots of those teeth before, during, and after the root canal. So you actually, the tooth is kind of like a sponge, and you've got all these little nooks and crannies and places for bacteria to hide. So you will have a significant shift in the bacteria in and around that tooth when there's no longer blood supply. Because some bacteria are aerobic, they really love and thrive and need oxygen, and some are anaerobic. And so when you shift from those aerobic bacteria to those anaerobic, I like to think of it as then you get kind of the bottom feeder bacteria, like the creepy crawly stuff.
Gross.
It sounds
Wow.
so amazingly delicious.
Yeah.
Uh, wow.
Yeah.
And so that shift in the microbiome in the area can create a bit of an immune response. So you'll have a little bit, it's something that the body then has to deal with. It's, when my biological colleagues, when they say there's now a dead tooth in the area, it essentially is. It's a dead tooth. It's like a mummified tooth. And so your immune system is having to maintain that to keep the rest of the body healthy. And so some people will notice that they start to have chronic health issues, like so many of us do, start to have chronic health issues that pop up, and they're able to connect that to, oh, this disease actually started 6 months or so after I had a root canal done. And then some other people started to notice, hey, when I had my root canal removed, I actually started to feel better. And so that's where things get really complicated, and dentists have to be careful with what they say or don't say, because we don't want to, you can't directly say that a root canal is going to cause X, Y, or Z health issue. But we noticed some really interesting correlations that are worth talking about. It's just like we talk about amalgam fillings last time.
No, well, a little bit. We're going to talk about that today, actually.
Well, let's compare it to cigarette smoking.
Okay.
Like, we all know the 80-year-old Uncle Dave, 80 years old, smoked a pack a day for his entire life and was fine.
Right.
Like, he he farmed, worked on his car, things were fine. And then you might know somebody else, another person in your family, maybe only smoked for a couple of years, but had issues, had lung issues, or was diagnosed with lung cancer or something like that. So it affects everybody differently. It all just depends on how full is your toxic bucket already. How resilient is the rest of your health, and how are you able to handle that tax on the immune system? So root canals, I think, are in the same family because it's a toxic exposure that your body then has to deal with. And some bodies are going to be completely capable of dealing with that, and some may be less so. And I think the more we are exposed to all of the unknown chemicals in our environment, all the junk that our bodies now have to deal with, stressors that are chemical and psychological, and all kinds of stressors that we have to deal with, then I think more and more people are less resilient and less able to handle that exposure.
Mm-hmm. And even just a little bit of that exposure and that repetitiveness of your immune system paying attention to it, the more we can cut that out, the better, right? Then we're just getting stronger all the time and not having these little things that can tax us, that
Right.
maybe one of them is finally that tipping point.
Right. Exactly.
Yeah. Yeah. So what are the alternatives? What do you do when someone has this inflamed nerve?
It gets kind of dicey, and sometimes we really don't have good options. So if we catch an inflamed tooth early, sometimes we can do some ozone injections. We can apply ozone to the area, different desensitizers, see if maybe the bite's off, do something just to support the healing of the tooth. And sometimes we can reverse that inflammation before it becomes so bad that you have to address it with a surgical procedure.
Wow.
If not, and there are very clear symptoms that the tooth is dying or dead, we're talking like spontaneous pain that's like an 8 on a scale from 1 to 10, throbbing in the middle of the night. Like, if we're to that point, then our options are not fun, because if we can't get that inflammation to reverse, then we really need to decide, are we going to keep the tooth and mummify it, do the root canal, or are we going to make plans to lose that tooth?
Wow.
And that's not a fun decision.
What causes it in the first place?
A lot of different things. So it can be large decay can cause it.
Like if a cavity just gets out of hand or something?
Yeah, if a cavity gets out of hand. Sometimes it can be dental work that's just close to the nerve.
Oh, wow.
Sometimes teeth just get ticked off at us. Like the cavity wasn't into the nerve, but it was close enough that just doing the dental work created enough of an inflammation that it couldn't recover. And that's where you have people say, oh, my tooth felt fine when I came to see you, and now that I've had this dental work done, now it doesn't feel fine. And the patient's really ticked off, and it's not necessarily the dentist's fault. And then sometimes it could be a fracture in the tooth. Fractures cause that very frequently, because then you've got a direct exposure to the nerve of the tooth. So those are the most common.
Yeah, it's hard to know. I just had a flashback to this time that I had something, maybe a filling once, and like I literally couldn't chew on that side of my mouth for like, I don't know how long. And then I went back and told the dentist like at my next visit, and he was like, "Why didn't you tell me?" And I was like, "I don't know. I thought it was normal. Like, people don't know what's normal, what's not. We don't, like, we're not educated on it. We don't know At least I'm kind of like that people pleaser type where I'm like, oh, it's fine. You
don't want to bother that son.
yeah, I don't want to bother them. Like and that's dangerous, right? Like we can get caught up in that. So speaking of cavities, let's talk about silver fillings because we did talk about cavities and how they can heal or move toward healing last time, which is fascinating. So if anybody missed that, definitely listen to that. But I listened to some of your content about silver fillings, mercury exposure, replacing fillings, and that's super interesting too. Mine have all been replaced, but I didn't even understand why they were being replaced because I'm a child of the 70s. I'm like, I don't know what they were using them, but they were silver.
Yeah. So if they were silver, then they were half mercury. And so I know. I know.
Oh, I'm glad they're gone.
Me too.
Yeah.
Me too. And it was such a fight to get them gone.
Like why? And what did that mercury cause in people? My mom had, I think we talked about her, she had ulcerative colitis. She had, autoimmune stuff going on. Like, who knows?
Right. Exactly. Who knows? Well, we do know that mercury is just a really potent neurotoxin. And so when you're exposed to mercury vapor, as you will be when you have those fillings in your teeth, anytime you apply heat or friction to those teeth, which is, by the way, every day, because you brush your teeth, you chew food, you drink hot drinks. Every time there's heat or friction, you'll get a little bit of mercury vapor that's released from the fillings. Super, super tiny amount. But mercury vapor, when you're exposed to it, it likes those heavy metals, they like to settle. And mercury specifically, it likes to settle in the fatty tissues of organs like your kidneys and your brain. So a lot of people will do a heavy metal detox to, get rid of all the heavy metals. And there's all kinds of different testing that naturopaths use and functional medicine docs
Have
use.
you done one? Have you done one?
I have, yeah.
Yeah. I haven't done one, and I hear about people doing it. Maybe I should.
It's kind of fun and it's interesting to see.
Fun. Okay, good. Fun. Good time. Okay.
If you're looking for mercury specifically, I like the ones that do, there's a try test by Quicksilver.
Okay.
And it'll look at hair and urine, and it gives you like a good broad overview of, are you actively being exposed to mercury? And are you processing it? Are you getting rid of it? Or was there some in an exposure in the past that'll just show up in your hair?
Okay, that sounds totally fun.
Yeah.
Yes. I love that kind of stuff. I love
It is a fun one.
testing and all that.
But I really like, some people will just go all gung-ho with the heavy metal detox, but or maybe the naturopath will forget to ask if they still have amalgam fillings in their mouth. So if you do one of those heavy metal detox protocols and you've still got mercury all in your mouth, you're going to be pulling a ton of mercury, not just from where it's stored in the rest of the body, but you're going to be pulling more from your teeth. So you're kind of just really stirring stuff up. So
what year did that stop? Or does anyone still do that? They don't, right? Is it like outlawed?
It's not outlawed yet. This is how healthcare just moves really, 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 really slow. Is that just a few years ago, the FDA said, okay, we maybe should stop placing these fillings in pregnant women and children and those sensitive to the product. I mean,
the product meaning something with mercury in it?
Yeah. So who's sensitive to that? Everybody.
All sensitive as humans? What?
Yes.
Wow.
Yeah. Yeah.
Oh my God. So what are they filled with now? What do I have? What? I don't
The
even.
white fillings, the two colored fillings we call them composite. Which it's a composite of like glass and porcelain and plastic particles. So it's still not natural. Still not natural, guys.
Okay, got it.
You can be very careful with how you source them and use products that don't have BPA, that have fewer of the plasticizers and more of the porcelain particles. So there are like glass ceramic based composites that you can use that I think are cleaner. But anytime we're putting something man-made in the mouth, like it's a blend of function, function versus safety. And those two things are sometimes competing. Sometimes. So
I haven't thought about this, like what they're made of. I'm like sitting here like, oh shit. And then my teeth are bonded, my front teeth, because I grinded my teeth for a long time. They got chipped.
and there's no perfect answer. There's no perfect answer because you can do like the porcelain, the zirconia, that tends to be really biocompatible. Porcelain's
Nice.
in the mouth, zirconia in the mouth tends to just be really friendly to the rest of the tissue. It tends to do really well. But then it's a lot of times more invasive of a procedure to do something that's made out of porcelain or zirconia. So it's like, which do we do? Do we lose more tooth structure or do we do something that's got a little bit of plastic in there?
What do you do? What do you do?
We do both. We do both. If it's something that's filling size, like if it can still be a filling, I'm going to do a filling. And I source my ingredients, my products as cleanly as I can.
Mhm.
If it's something that we really need the structural support of the porcelain, and then usually I'm doing a zirconia.
Cool. I like the idea of having zirconia in my teeth.
Right?
I don't know. Now I'm thinking about my night guard. I don't know what my night guard is. I'm spending 8 hours a day in that thing, and
It's usually a BPA-free thermoplastic, usually.
that sounds right. But still, I'm like, sheesh. That's something I hadn't even thought about when I think about microplastics and all that kind of thing.
I know.
All right. So then from there, we go to sealants. And I know you talk about sealants. And then you even mentioned that you can get cavities under a sealant, which is utterly frightening. So let's talk about sealants and how to keep those safe and pay attention to those.
Yeah, they were my frenemies for a long time.
What do you mean?
Because it was so good. I love the concept.
I do too. I've had them for years.
I've had them.
Yeah.
When I was in dental school, I asked a friend to put some sealants on my teeth because I had deep grooves that had a little bit of stain in there.
Yeah.
So I had some sealants done myself. But it's a similar type of material. So it's got plastic particles in there in order to make it nice and flowy, to be able to flow into the deep grooves of the teeth. But look, if you look at the peer-reviewed research, and this is where like even some of my functional and biological colleagues disagree with me, and that's okay because I just like that we're talking about it, honestly. But so if you look at the peer-reviewed research, sealants do very well. They absolutely do prevent cavities in kids, which is a wonderful, wonderful thing. But all of the studies that I look at are only looking at their longevity for 5 years.
Wow.
Maybe 10, but usually 5 years. And so like they're saying success is like a retention rate of 50% or better after 5 years. Well, crap.
Yeah. Yeah.
What's happening to the rest of them? And like
What is happening to them?
the pediatric dentists love them
Yeah.
because then these patients graduate from their practice and then they come to see me, the general dentist, when they're in their 20s. And that's when we see the problems happen. Is these kids in their 20s and 30s come to the office and now they've got sealants that, they've kind of chipped in a couple of places here and there.
Yeah.
They're no longer doing kid dentistry. They're doing grown-up dentistry, and they've got some sealants that are not perfect. And so that's where like bacteria just gets stuck under the little broken pieces of the sealants and can actually hide a cavity so that it's harder for me to see until it's gotten, at least 20% bigger than I would have seen it otherwise if it wasn't being hidden by the sealant. So that's why I fell out of love with them is, I would see in my previous practice, I would see sealants that I placed break and chip, and then sealants that I placed where there was a cavity hiding underneath. that was not okay with me. That hurts my feelings.
How can you even see the sealants? That can't be that easy. I mean,
Yeah, they're usually bright white. The sealants themselves are bright white. So
okay. I thought they were clear for
you
some.
can usually see them. Now they do, like, they stain a little bit over time, and some of them are less bright and do kind of blend in with the tooth a little bit more, which is nice unless you're needing to see that there's a sealant still there and that it's all in one place. So I just don't love them. I'm like, I really, really, really want to protect kids' teeth. I just don't want to use a sealant anymore to do it in the current state that I see sealants typically. Like, if we can have, better isolation, like better treatment methods, more careful placement of sealants, we can get better results with them. But then even still, I would want to, until we come up with something better, I would want to take them off. And there's not really a super easy way to take them off without me getting my drill out at least a little bit to take them. So I just stopped placing them, and that's what. And apparently, I made a bunch of people all up in arms when I said that on the internet. So
Really?
I wound up the anti-sealant girl, and that was not my intention to be the anti-sealant girl. I just got to where I didn't like them anymore.
I think your reasons sound completely valid. I'm going to go ahead and validate your anti-sealant, and I'm concerned about my own. I mean, that's super important to pay attention to, especially with children. And I'm sitting here thinking, we're not taught really anything about any of this. I have sort of just blown off my own knowledge about all my dental care. I don't even know where my fillings are anymore. I don't like, I mean, I guess my dentist has a record of, the dentist I use now has a record of stuff, or you can take the x-ray and tell, but I don't know. I'm kind of disappointed in myself, and I haven't taught my children to. I just feel like I've dropped the ball, and then I'm like, well, we're just not really taught that.
No, we're not taught that. And there's, I mean, there are very few people who do know all the things that were done to all of their teeth at any one point in time. They remember.
That makes me feel better. Or you'd say a small percentage actually know?
A small percentage. Every once in a while, I even have a patient who knows how we number teeth. And that,
wow.
And that's when you know they really are paying attention. But that's rare. That is very rare.
Okay, I want everyone to feel better about that, because I don't know. I hear this and I'm like, why have I done all this stuff to myself and been complicit, kind of, almost, and not even like, I just put blind trust,
Well, we do that with everything. And we do the best we can with the information that we have.
Yes, we do. Yes.
And I used to use fluoride on everybody, everywhere. There are lots of things that we do because it's what we think is best. So I'm definitely a part of the No Guilt Club. We do the best, the information we have.
Yeah, I like that.
And I also don't think, that moms or parents or anybody should feel guilty if they've had their kids sealants placed on their teeth. I don't think that's a reason to feel guilty at all. We just want to be careful with them and make sure that we're really, really being OCD about how often your dentist checks them, which is easy to do.
Good. Great advice. Okay, let's move on to the next topic, unless you have anything to add with that one.
Yeah.
Okay, the next topic I would love to discuss. I saw you had something about menopause and perimenopause and oral care and dental health and biological dentistry. So I don't have a particular question about that. I'm just curious about how changes. I think we might have touched on hormones last time, but actually, no, I'm not sure that we did. So maybe, is it hormonal changes that can cause changes in our oral microbiome?
Yes, absolutely.
Yeah.
Changes in our oral microbiome and changes in the consistency and quality of our saliva, which is huge.
The consistency and quality of our saliva, really?
Yeah.
I'm going through something right now. Okay, something's going on with, like, me, and I feel like I'm close to menopause. I'm 53. That's normal. And so, like, when you say that, I've noticed that something is going on, because I talk a lot. and like something has changed. In fact, just today I was like, what is that?
All your wet parts dry out.
Oh, shit. God damn it. I got to get a lube for my mouth. Is that it?
Yeah. Lube for your mouth. I should come up with a product and call it lube for your mouth.
Yeah.
And then I will give you royalties.
Wonderful. I mean, like, okay, that now that when you put it like that, it makes total sense.
Yes. So your eyes dry out, your vagina dries out, everything tends to dry out, including your mouth, when your estrogen lowers.
Okay.
Which can really have significant impacts in all areas of your oral health, especially. And even, when your hormones are fluctuating, your progesterone dips, that can mess with your sleep for some people. And so now when you were doing fine before in your 30s, all of a sudden you're sleeping with your mouth open. You're not sleeping as good. So your mouth is dried out. Your sleep sucks. Then you are set up for inflammation and a change in your microbiome that can, depending on what you're more susceptible to, it might put you at a higher risk for cavities, or it might put you at a higher risk for gum disease, or maybe both. So there are things that we can do. Like, obviously, if we address the hormones upstream, then we won't have to do as much dentally speaking or orally speaking. But orally, we can do there. I really like xylitol sprays. There's a spray by the brand Clear, or it might be Spry is what that one's under. They're part of the same company. Oh, goodness. I actually have it. Oh, do you put products on your show ever?
Yeah.
Can I show the little bottle?
You can show whatever you want.
Okay. So I just happen to have them.
I've seen that.
And I love this stuff. It has xylitol in it, so that helps with the microbiome. It helps prevent your saliva from getting too acidic. And it's got a little bit of glycerin in it, so it's soothing. It will help kind of coat the inside of the mouth. You want to coat the oral mucosa if you're drying out more often. And that can be just really, really super helpful. And these ingredients are on the floor, but really, really helpful, clean ingredients.
Okay. Excellent advice. Is there anything else for like perimenopause, menopause that we can start doing? Michael, really?
I would say it's like many areas of our life, it's a good time just to up our maintenance game just a little bit. So I would say in all areas, wherever your weak spots are, if you tend to get bleeding gums when things are a little out of balance and out of whack, then you might want to floss a little bit more or switch from floss to a water pick. And that can sometimes really help with the gum inflammation. If you tend to get plaque that builds up quickly in between your dental cleanings, then you might want to switch to upgrade your toothbrush, switch to a Sonicare or something that's got a little more oomph to it. So we're like very fine sports cars, and we just need a little bit of maintenance.
Yes, we do.
And our maintenance gets more expensive as we get more wise.
Tell me about it. Yes, unfortunately it does. I'm aware. Yeah. So that's all really manageable stuff, though. Like, you're not saying anything that's like a Bentley, really. Like, it's all stuff that we can totally handle. And I think there's just a element not only of taking care of yourself, but also just paying attention and just being just like shifting into a little bit more awareness, because I think when you're busy in your 30s or 20s or something like that, you can tend not to. But the older we get, we can't really afford to ignore things or not notice.
Is that what perimenopause and menopause is all about? Like this phase of life, I'm just entering this phase of life in my mid 40s. I feel like it is about being more wise with how we steward the bodies that we get to live in. So just taking more care, knowing that taking care of us helps us take care of our families better.
Yes, it absolutely does. And well said. I like steward, these bodies that we have been blessed to live in. That's really beautiful. Well said. All right. So as we say that, what do you consider the optimal diet for dental health? Because I just want to say, are there some dangers? I think there would be, and I'm pretty sure you do too, of like a liquid diet, a cleanse, a juicing cleanse, and those were really hot, like I don't know, 15 years ago or something like that. But I thought this isn't good. We're not chewing. So
Yeah, I totally agree with you. And I will even go so far, I will willingly offend the vegans in the audience. It's not because I want to offend them. Um, I don't want to offend anyone, but it is harder. It is harder to achieve a good dental health on a strict vegan diet. It's not that you can't do it. And I have patients who are vegan who do very well. But I also have vegan patients who have done it without a whole lot of intention and help, and things have gone awry. So
what? Like what?
Like an increase in inflammation and an increase in cavities because
They're not eating what, meat?
they not getting enough nutrients where like the protein is a complete protein in meat. So it's easy to get the complete amino acid profile. Whereas with a vegan diet, you have to make sure that you're combining foods correctly, that you're getting that complete protein by different types of foods that you're eating, like grains plus legumes to get all of the amino acids, the essential amino acids. Sometimes vegans don't get enough high quality fat. It just depends. Again, you just have to be really intentional with it. So I would say the vegans who are vegan for religious reasons, ethical reasons, we can make it happen, but we got to be really, really intentional that we're getting the full profile of nutrients. If that's not you.
And by the way, I eat vegan a lot. Not offensive at all. No, totally. That's all really good intel. And you really do. I mean, I go back and forth. I'm not super hardcore. I will eat meat sometimes. I'll eat anything sometimes. So, but when I'm left to my own devices at home, I really stay extra plant-based, super healthy, good fats, all that. But which I think is great. I love it.
We're intentional with it.
Very, very. So, and I have a lot of ethical reasons around it, but I'm not hardcore. So whatever, vegans can judge me on that if they want. So, but no, it's really interesting to think how that's affecting our oral health and like to really pay attention to that.
Yeah.
What else? You were continuing to say something else. Sorry.
If there are no ethical issues that you're concerned about, that obviously if we're choosing to eat meat, then we want to make sure that we're sourcing it as ethically as we can. And so a traditional diet, like good quality, if we're going to eat animals, then again, not only are we stewarding our own bodies, but we want to steward the animals that we're blessed with as well. And so sourcing those really well, making sure that we're doing organic and grass-fed as much as we can, as much as you can afford to do. And there are some way more affordable ways to do that now than there used to be. Making sure that we're getting a lot of good, healthy fats. And that can be animal or plant-based fats. But we have to have enough fat in the diet to absorb all of the fat-soluble vitamins, because those are the vitamins that we really, really need for the health of our teeth.
Wow.
So good, healthy protein, good, healthy fat will help us absorb the nutrients to have healthy gums, healthy teeth, and lower inflammation.
Wow. That's so interesting and so important. I mean, like, you can probably tell when people aren't eating right, when you're looking at their teeth, like if they're struggling with an eating disorder or something like that, I'm sure. Okay. So that is super fascinating. And what about the importance of chewing?
Your mouth is the first part of your digestive tract. So you've got to be chewing so you can stimulate the digestive enzymes in your saliva so that you can break down the food as much as you should before you swallow it. So again, it's just an extra tax on the rest of your digestive system if you're eating in a hurry and not stopping to chew the way that you should.
Yeah.
So, yes, take your time.
I just always thought juicing diets and stuff were a little bit dangerous and stuff too, because I feel like you're missing that important component, and it can
Totally
really
agree.
screw up your system maybe. So yeah. All right.
Especially if we're doing like a true juice and not having the fiber and the rest of the plant that goes with it. If you're stripping away the fiber and the chewy parts of the plant and you're left just with this sugar bomb that can be pretty acidic, and I agree. I think they're good for a time. If you're doing it like as a cleanse, just to kind of reset things, I think that can be helpful. But to do it for a continued length of time, I think can be not so helpful.
No, certainly not. So, all right, let's talk about uh, ozone therapy. I don't know what this is, and I think you recommend it for something.
I recommend it
For a vague question.
almost everything.
What is it? What is ozone therapy? Like
Ozone,
ozonated water? Is that what you were talking about?
yeah, and we use
What's that last time?
ozone gas, and it's like the hot sauce commercial. I use that shit on everything.
Really?
Yeah.
I get it. Do I have
So
doctor?
in the dental office, we use medical grade ozone. So we're taking medical grade oxygen in an oxygen tank. So it's super pure, no like pollution or impurities or anything like that. And we run it through an ozone generator. So you're applying an electrical current to the oxygen, and it converts the O2 to O3. And that O3 is a really, really powerful oxidizing agent. And people will ask all the time, well, isn't that dangerous? We hear about ozone in the ozone layer and high ozone days. Like, we want to stay away from that. The reason that it's bad when it's in referencing weather and the ozone layer is because ozone is like our atmosphere's cleanup crew. So when it falls to lower parts of the atmosphere, it's cleaning up the pollution in the air. So when we have a higher ozone day, it's because there's so much pollution that the ozone has to come down, and you'll have higher levels of ozone in order to clean up our mess, basically. When it's applied, it's same oxidizing action in the body. And so that means it will kill bacteria, and it's different than antibiotics because they can't develop a resistance to it. It's oxidizing, it's basically eating away at the cell wall of the bacteria, and it can't develop a resistance. So it kills bacteria, it kills viruses, it kills fungi, and it will also help wash away any of our dead or dying cells in the body too. So in doing all of that, it helps upregulate our own immune response. It's kind of like supercharged oxygen to our cells that are healthy and doing well. So in essence, it helps clean out the bad stuff and gives our good cells the oxygen to upregulate our immune response that we need. So it helps with inflammation. It just helps support how the body is healing on its own, which is exactly what we want it to do.
So when you say you use it all the time on everything, what's that look like for you or your family?
In the office.
So it's only in the office, or what about your home?
I actually do have an ozone generator in the home, but I use that for different areas, like to clean.
Well, I've heard of this, and I remember looking it up. Someone told me about it, and I like went researching and went down a little rabbit hole. Now that you talk about this, so
Right.
What does it look like in the office then?
In the office, so it starts by every morning we ozonate our water. So all of the water that we use in our dental chairs, so the water that comes through the drill, the instruments that the hygienists use to clean your teeth, all of that is ozonated water. Ozonated water is great because it's a gentle version of ozone. So helps with inflammation. It keeps our water lines really clean because we have to test those periodically to make sure that there's no icky gunk in the water. And so we use it all the water all the time. So everybody gets a nice little dose of ozone water when they're in the office. But then we use stronger version. We use the gas itself, the ozone gas, more directly. So that could be a sensitive tooth. I can turn on the ozone handpiece, and the ozone air is coming out of the little handpiece, and I can stick it on a tooth to help with sensitivity or to help protect a nerve from deep decay. Then we're trying to, in these teeth that we're trying to avoid it needing a root canal down the road. Or I can get even deeper than that, and we can inject it into the soft tissue or inject it in a socket where I've extracted a tooth.
Inject what? Like
the ozone gas.
Ozone gas? You inject ozone gas?
Yes.
Whoa.
It's a tiny, tiny little bit. It's just in a tiny little syringe that we pull up from the ozone machine.
Wow.
But it works really well. And it's really cool to see it in action, especially like when we remove some of those old infected root canal teeth. The socket, the bone and the blood around it gets like kind of brown and cruddy looking and just icky. Like the area just looks dead.
Yeah.
And so when we apply ozone to that socket, you'll start to see the color of the blood in the socket change, and it gets like this bright, beautiful red again. It's really cool.
That's amazing.
Yeah.
Yeah. I use a high frequency wand on my face, and it always smells like oxygen. It smells like that ozonated smell. And I know it cleans the bacteria and stuff from my face. And I feel like that's like everything you described is what it does. And I love my high frequency because that's what it does. But I don't know what the frequency, it's like
if it's actually releasing a tiny little bit of ozone, maybe.
It's got to be, because that's what it smells. It has a smell, right? Like,
yeah. Like kind of like chlorine, similar to
it's like that oxygen smell. It's just like a clean, and which I like that smell. I mean, like to me, that's just, and it just smells clean too, but it just like clears the bacteria and stuff. But wild. So that's super fascinating, and I'm sure like a lot of dentists. I've never heard of my dentist offering that, so it's very cool.
I don't know why mainstream dentists aren't using it, because it's such a helpful tool. But it's mostly the biological dentists that are using it. It works great.
Yeah.
Amazing. It's not, I think that's the thing with anything natural. You're usually not going to get a pharmaceutical type of response. Because if you're using a pharmaceutical or something, really strong that Western medicine is great at, then you force the body to have a certain response. And when you force the body to have a certain response, you're going to get collateral stuff on the back end. Maybe a little collateral damage. Maybe it's just that the body is shifting focus in a different direction. But you can't force the body to do stuff without a reaction somewhere else. And so I think ozone is probably one of the strongest natural things that we have, because it nudges the body in the right direction. It's more of a nudge. So we get less of that icky response on the back end. So we're really not seeing a ton of, negative side effects.
Yeah.
We're just supporting the body to do what it needs to do on its own.
And I mean, the healing power of oxygen is so real. And I'm guessing, ozone would be considered that. Have you ever had anybody go into hyperbaric and heal anything orally there?
I want to make more of my patients do this, because I'm so interested. The data around it is so good. I think it would help post-op inflammation a ton. I just don't have that many patients who have access to it yet, or have one that they can just go to right down the street. I'm friends with Dr. Rob, the explant surgeon in Austin, and he has it in his practice, and he keeps trying to tell me that I need to just get one in my.
Yeah, super interesting. I mean, like the people I know that have used it for healing, it's just really wild, the results that you can get. So I'm so curious, like,
Yes.
what it could do, like why not try it too? And if people are listening and they're like, I have this, and we have a good one here in Austin too. I think there's one in Westlake, so that I know people have gone to. So really, really cool.
Absolutely.
Yeah. Let's see. I saw you talking about hydroxyapatite nanoparticles.
Mm-hmm.
Please elaborate, because that sounds I don't know, fancy.
Or, I mean, some people say it sounds kind of scientific and scary.
Scientific, yeah, yeah.
When we're talking about nanoparticles, it's such just a really fantastic tool to help remineralize teeth.
Oh, okay. We
What?
talked about this with cavities too, remineralizing.
Yes. And the calcium hydroxyapatite is what our tooth enamel is already made out of. So we already produce it. We already make it. It's very, very natural. But they found a way to, and there are two forms that you can get, natural or synthetic. You can get lab-made hydroxyapatite products. You can get that as an ingredient in toothpaste. The nanoparticles tend to be man-made instead of natural. And so this is where, depending on what's important to you, let's have the conversation. Because if it's important to you to only use things that are natural wherever possible, then we need to have you using a microparticle hydroxyapatite instead of the nanoparticle, because the microparticle is usually natural. If you are a strict vegan and using any animal product is a no-go for you, then we need to use the nano. That is man-made, because the natural stuff, the micro, is typically bovine.
Okay. Wow.
So, from our friendly little cows.
Okay. Awesome.
So either source that you use, either source of hydroxyapatite that you use, it tends to do just really, really well at helping that remineralization process. So depending on how big or small the particle is, again, the nano is going to be the smallest particle, so it'll go a little bit deeper into the enamel. And so it tends to be more effective at remineralizing the teeth, because it can just go deeper into the tooth. It can go deeper into that crystalline structure that's already there.
I have to tell you, this is a confession. Please don't judge me. I have been using Crest white strips for many years, off and on. Do I need to remineralize my teeth? And what do you use to whiten your teeth, or you tell people to whiten their teeth?
So no judgment, Sim. Thank you.
Vanity wins sometimes. It's just easy. And I'm
Right. And that demineralization, that's not going to happen as much with the Crest white strips. What will happen is that if you do it excessively, then it'll create some little micro etching.
What's excessive?
If you're using it once a quarter, then I think you're probably fine.
But more once a month. More like once a month. And I'd use one. Maybe I'll use one during a week. One. I'm not doing a whole series. So, no. Oh, okay.
Okay. I'm not worried about you at all. Okay. And you can always, support the teeth afterwards.
Oh.
So if you drink lemon water, you have some vinegar and something, just support your body afterwards, and that's fine. So after you whiten your teeth, if then you apply a hydroxyapatite toothpaste, then you'll help repair any of those little micro abrasions that can happen, that micro etching that can sometimes happen in the enamel, and then you've supported it. And I think that is perfectly fine.
I love it.
Do those have super amazingly clean ingredients? No. There's a brand called Lumino that makes white strips that you can get usually in the health food store. Those tend to be a little bit cleaner. But but sometimes they're just not as good. So you can try it, see if it works for you. And if not, then I'll just turn an eye to your white strips.
Yeah. All right. Good to know. And speaking of cosmetic dentistry type issues, how do you feel about like dental decorations, like gems and things like that people put on their teeth? My daughter bought a gem kit for her teeth, my 20-year-old. And so I know because it came when she ordered it, it came with like something that it wasn't like a drill, but it wasn't something that it made me worry about the enamel.
Oh, interesting.
Yeah.
I need to get some of these kits. Did you just get it off of Amazon or something?
Yep.
Okay. I will have to get some of these kits to see. I knew that there were some independent business owners who would apply these, and they were usually like former dental assistants or like active dental assistants who would do this like as a side gig at night. And they would actually use like the real etch that we use in the dental office and the real bond and put these jewels, bedazzled things on people's teeth. I don't love that. I think it's
scary.
I think it's reckless. And yeah, I would be careful of that. I would be careful of putting anything on your teeth that might be a chemical or something that involves any kind of removing of tooth structure.
Yeah. Yeah. Oh my God. You must hate like mouth tattoos and stuff like that. Oh my God. Have you ever seen one in real life?
Yeah, they're kind of creepy.
So I don't know what would possess someone to do that, but hey, no judgment. We're not going to judge you.
Not judging. I mean, I've seen crazier things. I saw a patient one time who actually did like the snake tongue thing.
Oh yeah, I know. I have a friend who did that. Who has his tongue. He was in a body modification like group for a while, and he slit his tongue and it's like separated. And you never know when you talk to him. You would never know. And then he'll stick it out and you're like, how did I not notice that? I bet. What else have you seen that's crazy?
Oh. I mean, lots of creative dental work from other countries.
Oh, wow.
Like very creative dental work where you're like, that's ambitious.
Oh my God, that sounds fascinating too. Oh my God, that sounds like it would haunt my dreams. But yeah, yeah. All right. Well, we're at the end of my list, and I'm wondering, is there anything big that we missed? Because I know you can't really quite recall everything that we talked about in the first episode. No big deal, but I feel like we covered a lot. Is there anything that's outstanding to you that you're thinking like we should talk about or touch on?
Gosh, I think we talked about airway stuff last time. Oh, yeah.
You did. Oh, yes.
About babies. Yeah,
we did. Mm-hmm. Yeah.
No, I think we covered the big stuff.
Great. Awesome. Awesome. And I'm so grateful. If there's anything that you'd like to leave people with, just a last thought or reiterate something today as we go, I'd love to hear from you with whatever you'd like to leave people with.
Trying to think if I have any additional wisdom from the last time. I don't think I'm any wiser, honestly.
Oh, I bet you are. I bet you're getting wiser all the time. Mm-hmm.
I will say, similar to last time, that, again, like we said, there's no guilt, there's no shame. Your body was designed to heal, so be encouraged that your body can do amazing, wonderful things. And that, we talk about all these nuances and all the things that, I wish we hadn't done this, or I wish we had done this better. I wish this was more natural. Just know that we all do the best we can. Nobody's going to do everything perfect because we don't actually know what's perfect. So do the best you can with the knowledge you have. And I hope that you gain just a tiny little nugget here or there that you can take with you to use down the road.
Yeah. perfect is a myth. Everyone's different. There's no such thing. So I love that you said that. And thank you so much. And I'm going to put in the show notes, you have a really great link tree and you offer a tooth meridian chart for free, which I thought was really, really cool. So I was going to share that with everyone because we had talked about that last time as well. And everyone should follow you on Instagram. You have tons of great content at Dr. Toni Engram, ENGRAMTONI. And all your links will be in the show note. Anything else before we go or anything I missed?
So much. No, this was so fun. I'm so glad we got to do this again.
I am so grateful because I felt like there was still so much to talk about, and obviously there was. So thank you for making time. This is such great intel, and it's really going to stick with me and change a lot about the way that I take care of myself. So thank you, Toni. You are just amazing. I'm just so grateful. Thank you.
Thank you.
I highly recommend going and following her, checking out her practice. And then, of course, there was a resource that we talked about last time that I'll put in the show notes again. I put it in the first episode that is all about how to find biological dentists in your area and, actually do some of this cool stuff that she talks about. And who knows, maybe they'll have a hyperbaric or something like that. Anyway, super, super interesting. I really meant that about, it's changing the way I think about this and the things that I do. And, I think a lot about my mother because I remember her fillings and I was little. You know how kids will say anything. I was little and I would be like, you have green teeth. So rude, right? And she would get so annoyed with me. She was like, oh, Amy, and I was like, but you do have green teeth. But like her fillings had made her teeth look like discolored, and they probably weren't green, but they're like gray, whatever the color they were, they didn't look right. And so she ended up having those replaced, but who knows how much, because she had to be in her 50s when she got them replaced or whatever. And I remember her having several on both sides, but that's what they did back then. She was born in 1936. I mean, think about like cancer, like all these things that could be affected just by whatever's going on in our teeth that we thought was safe, that we were told was okay. So wild. So anyway, and well, as I said, she had ulcerative colitis that she got at a later age. It's often affects people that are younger, maybe 20s, 30s. And she was 55, I believe, when she was diagnosed with ulcerative colitis and had a really tough time with it for 14 years until she passed away from a tumor that was related to the ulcerative colitis, unfortunately, and she passed away at 69 in 2005. So, anyway, it just made me think a lot about her and just all the people that have these things going on in our mouth that we're literally swallowing and are permeating our body all the time, literally all the time. So anyway, okay. Well, there's that. I love you so much. You're so awesome for turning up. And how badass was this, right? So good. So, follow the show. Follow us on YouTube. I am starting a new podcast that I'm super excited about that I will be telling you about soon. And what else? Stay at Skyrock if you're going to Sedona. If you need hair extensions, we got you right here in Austin, Texas at the Collective. Look how good mine look. Oh my, I love, why'd I say it like that? I love it so much. Anyway, I love mine so much. I want to know what hit you in this episode too. So connect with me anytime, reach out anytime, comment anywhere. I want to hear. And I always look and I always read everything. So thank you so much for being here. I just love you so much. Keep shining bright with those pearly whites. Till next time. Thank you so much for being here. Please rate, review, and follow us. And we'd love to hear your feedback. Keep shining bright.